Thank you for joining, everyone. We're going to give folks another minute. I'm looking at the number of participants we have. I'm just seeing the numbers go up literally as we open up the presentation. So I'm going to see how many people we have. I know we have quite a few people registered for this event. So the numbers are going up pretty quickly. We'll give folks another few seconds to start, to join, and then we'll start. Great, I see the numbers just climbing as we speak. I kind of look at it as a ticker. As soon as we have a few more folks join. Looks like we have a quorum. I'm going to go get started. Thank you for joining today's webinar. Before we begin, I'd like to go over a couple of technical issues. If you come across any problems, technical problems during the webinar, you could chat the host. You can find the chat box by hovering over the bottom of your screen and clicking on the chat bubble. At the end of today's webinar, please complete our brief survey to give us some ideas for topics that you would like covered related to this topic or any other topics that you have an interest in. And then during the webinar, you can chat comments or questions to the panelists, and we'll compile those questions and hold them till the end and address them at Q&A time. Okay. With all that said, let's get started. I should also mention there are links to resources and then also the slides, the recording and resources for this webinar, as well as many of our other webinars, are available at www.ctacny.org, and they'll be available to folks within the next couple of days. And of course, thank you all for all the work that you do as essential workers during this pandemic. On behalf of the Community Technical Assistance Center of New York, it's my pleasure to welcome you to today's webinar, Supporting Parents of Children with Mental Health Concerns, Parenting Tools to Promote Resilience. My name is Jim Rodriguez, and I'm the Director of Trauma-Informed Services at the McSilver Institute for Poverty Policy and Research, and I'll be moderating today's webinar. This is the second part. This is the second part of a two-part series on helping parents and caregivers address problem behaviors in children with mental health challenges. Part one of this webinar addressed the challenges of and strategies for developing a productive and effective working relationship with parents and caregivers prior to identifying or providing strategies to address those problem behaviors. So it really focused on developing that really close working relationship with parents. Today's webinar is going to focus on some of the strategies that you all as providers can use as a coach and as, of course, a clinician to help parents deal with and address problem behaviors among their children. It's my pleasure to welcome Bonnie Siegel-Weisenberg. Bonnie is a licensed clinical social worker and clinical coordinator at Mount Sinai Hospital in the Department of Child, Adolescent, and Family Services. She has over 21 years of agency-based clinical practice experience working with children, youth, parents, and adults. She also has training, supervisory, administrative, and leadership roles at Mount Sinai. And she's completed training at the Ackerman Institute for the Family and is trained in dialectical behavior therapy. She's also a mother of a 9-year-old boy, so she can speak about parenting from both a clinical and personal perspective. And I want to thank Bonnie for stepping in to present after our original presenter had to cancel. So I know you all will benefit from her practice, wisdom, and experience. Bonnie?
Thank you so much, Jim, for that very warm welcome. I'm so pleased to be here today, and I really want to thank all of you. 90 minutes is a long time, and I know that people are busy in agency-based work. It is very, very busy. So I hope to give you some tools that you can use and make this a valuable use of your time. Okay. So in just thinking about our current context, this is actually a slide from another CTAC presentation given earlier. So today, the way we work with families, our own lives is so influenced by things, COVID being among them. These pictures kind of depict what's been happening in terms of our current social context, in terms of Black Lives Matter, in terms of everything that's going on. We're also, just in seeing, COVID and its effects on people. I know in my agency-based work, I'm often working with people with numerous psychosocial stressors, a lower socioeconomic status, so many barriers, and we know how things are so affecting of our particular population. So just to frame this, right, to frame within our kind of systems lens. Okay, next slide. So goals and objectives of today's webinar provide clinicians a framework in working with parents and guardians whose children are presenting with challenging behaviors, present strategies on how to work collaboratively with parents. And when I say parents, I mean guardians, I mean foster parents, whoever is kind of the adult and in that network of important people for the children and teens that we see. To understand children's and adolescents' behaviors and prioritize behaviors to address. Provide concrete examples of emotional toolkits and techniques to prevent and manage dysregulated and/or unsafe behavior. And again, we're really thinking in this context of COVID. Things are so different now than if we had been doing this webinar 2 years ago. So we will do a little bit more introduction around the issue. We'll do a quick review, as Jim did, around the webinar that came before this around engagement with parents. And then I've kind of broken things down into 3 different parts. The first part will be around collaborating with parents, a quick de-escalation slide or 2, which I will explain after, defining treatment and prioritizing behaviors to address. Part 2 will be around relationship building, fostering self-regulation, and managing distress. Part 3 will bring us back to de-escalation, and then we'll do a bit about behavior modification after that. Okay, so one thing that whenever I'm teaching or talking or with a client, I want to know where people are coming from. And then this way we can, given the presentation, think about things that people might be concerned about specifically and how that might be tied in. So please chat away your questions, concerns, curiosities in working with families where challenging behaviors are present. So let's see, trauma-informed collateral work. I'm not sure if anyone's having technical issues. I see things about muting. Let us know if you can't hear.
And so Bonnie, I can also help here. Are they, so questions about collateral work, trauma-informed collateral work. Are they happening at home and school? Try to reconnect and get back in. Oh, sorry, that was wrong. What occurs prior to behaviors? Yep. Resources to pass on to parents and schools for follow-through work. Working with parents of middle schoolers. Challenges: when parents struggle with their own mental health systems and diagnoses and either aren't addressing these issues or aren't motivated to engage with these issues, which then exacerbate their child's, yes, critical issue. Are you seeing these, Bonnie?
I am, and I'm hearing and seeing things around clinicians' own mental health, caregivers not having a break, their own mental health challenges, also specifics around what happens before, how long is the behavior. I'm sorry, how long has the behavior occurred? So people helping lots of people, supporting parents who are discouraged. All right, I'm going to move from the chat now. Feel free to continue chatting, and Jim will be monitoring that. But I so welcome these questions. I think that part of what people are talking about is already covered within the slides, because I too, again, I'm in it. I'm doing this every day with children and families. And I hear these concerns and I see them. So what is not in my slides, I will try to address or do it during the Q&A. So as part of the introduction, I think one thing, no matter your orientation, no matter what, if you're doing trauma work, whatever it is, you really want to keep in mind developmental tasks and a family life cycle, right? So we know children grow and develop, they go through different stages with different tasks. So for example, younger school-age children, helping them gain competence, skills, learning to abide by the rules of society, being able to, further their development in school and socially. Teens is really, we know teens are working on their identity. So if we think about Erikson, and it's, all about identity and thinking about separation and individuation. So how can teens separate to some extent from their family and remain part of the family system and become their own people? If you think about, right, the way Erikson has developmental stages, families go through developmental stages. So I don't know if anyone is familiar with Monica McGoldrick's work. She's a really wonderful family therapist, and it's really about thinking about family life cycle. So goals and needs of a family with a baby are very, very different than that of a school-age child, that of a teen, one whose children are already adults, right? So we think not just the individual, again, we think about the family and how the importance of families and each family member changing and evolving through that process. So I want to present guiding principles and theories. So you'll see that I have, I use an eclectic approach. I am informed by family systems, dialectical behavioral therapy, and that will be, throughout, there are pieces of this. And also just in my own knowledge and my own experience, kind of things that I try to think about and things that guide me. So individuals are seen within a family context and a systems context. So no individual is their own individual in isolation, right? We know people are in families, in schools. Again, we think about that slide around COVID, around social justice, all the different lenses, and knowing we can't just look at one piece without looking at the others, right? The importance of the caregiver role. Right. I think part of what led me to family training is that I was working in a mental health clinic and working as much with parents as with children. Right. And thinking about the caregivers and what a huge role they have. Right. And even when you think about individual work, you're doing family work, it's always kind of family and systems. Families are where kids are at, and there's a huge impact. So thinking about just from a stance, right? I know we're in agencies, we diagnose, right? There's clear reasons kids are presenting for treatment. And at the same time, we really want to come from a stance of curiosity, right? We know the mental health stuff, but we don't know the right answers. There's not one necessarily right answer. We want to hear from patients, families, clients, their thoughts. We want to elicit from them. We don't know everything, right? We collaborate, we come from a strengths-based and resilience building approach, right? So I always am asking families, well, what has worked before, right? Because that usually exists, right? And in terms of our role, we're like the coach in this, right? This is not for us to tell you what to do and then you're in therapy forever. I don't believe in that. We are working with clients and families for them to gain tools and skills to then be on their own, because people can. We know there is a mind-body connection. So in thinking about talk therapy, right? We are talking, we're working through things. We're also thinking about, and you'll see in this presentation, kind of ways to self-soothe, the way anxiety might manifest itself in the body, ways to be present. So really considering mindfulness and the impact of that, right? Can be very powerful in helping manage affect, de-escalate. So as a clinician, for me, it's important to be flexible, adaptable, to be aware of power dynamics, right? You are always the person in power, right? As the clinician sitting with your clients, thinking about things like ethnicity, education, all those things. They're all significant, and they're things that may be part of treatment that you're talking about, right? Willingness to engage in difficult conversations, right? We'll talk later on about how therapy is hard, right? Hard for patients, for anyone coming in. It's also for the therapist, it can be really challenging, and kind of skirting around issues might feel easy and comfortable, but it's not necessarily the most effective. So we need to think about how can we push ourselves to go into those hard areas. I personally feel like it's a privilege of being allowed into a family's private and personal experiences. I'm a stranger to anyone walking into my office. I make no assumptions about why people should trust me or tell me about anything, right? So it's really kind of honoring that relationship. Okay, so Jim gave a great overview of webinar 1. So I'll just go through some quick bullet points. It's about the strong working relationship with parents and caregivers. I'll talk more about that later on, but it's critical. You can't do any work until you have a working relationship. So there are challenges that providers might face in working with parents and caregivers. So this idea of blocked parenting, I really like this, because there are lots of reasons why parents are unable at times to remain connected with their kids. And working through that is so critical. Motivational strategies to validate and work through reluctance to try new things. Helping parents reframe the behaviors they see in children. We'll talk about that a little bit more as well. And there is the link. Please, if you haven't seen it already, I would really recommend doing the webinar. It's really, it's terrific. One of the speakers is a mental health professional and is the parent of, I think, 4 adopted children with significant physical and or mental health issues. And she speaks firsthand, and it's quite powerful. Okay, so if we're kind of breaking this up into parts. So our first part is going to address collaborating with parents, a quick piece about de-escalation, and then defining treatment and prioritizing behaviors to address. So where to start with clients? In an ideal world, right? We're orienting families to therapy. We are building trust. We're understanding what's happening and helping families develop skills. And what happens when families are coming in already in crisis? What happens when families have been under increased stress around COVID for over a year? For that matter, what about families who've been under stress for 5 years and they're now coming into treatment and they want some help, right? Immediate relief. Families want immediate relief. It's really important to think about when people are presenting and the fact that they might never come back. So in terms of what do you want to offer when you're first seeing them. So I want to just give a case example. If we could take a look. Okay, so this is a boy who I saw for I think 3 intake evaluation sessions, who's now being treated at our clinic. But if you take a look, it's sort of the elements of kind of everything that I was speaking about. So he was presenting after an emergency room visit. He had been hearing voices to hang himself and to jump from a building. He had severe anxiety at home. He had sleep issues. He was unable to get up for school at times. That was the impact of little sleep. There was exposure to community violence. They'd hear gunshots from their windows in the evening. And there was conflict at home between adults. The conflict, which was verbal and really upsetting and scary at times. He was in remote learning with his, home with his mother for a year, and then went back to school 2 months before presenting. He was bullied at school. He'd have severe mood shifts and be uncooperative around going to school and become extremely dysregulated when he would go. And again, you see my uncooperative in quotes. So this is a case to kind of just to think about, right? What would you do? Where would you go? Where would you start, right? Can we go to the next slide a moment? Right, so in thinking about this, you could be thinking about all the long-term things you might be doing. And you're also thinking, well, this is a crisis. This kid can't go to school. This kid has so much anxiety. What do we want to do to start, right? This is a family who is coming in asking for lots of help in many ways and for many things. And also like, what can I do right now? So the timing of this is really important. So I normally would think about de-escalation being at the end of the webinar, right? Because we'll kind of go through kind of this yellow, green, yellow, red scale, and red being at the end. And that's when you're thinking about de-escalation. But this is really critical. What is the family asking for you right now? And what is the situation, the seriousness and potential, harm or risk there? So we want to initially provide some de-escalation strategies when there's a crisis happening. So consider emotional and physical safety. How can you as the parent remain calm? This is in speaking to the parent, right? And really just some basics, retrieve anything that could be potentially harming, remove the teen or child from the situation. So this mom with this patient, she made sure that there was nothing that the kid could use to hang himself, for example. Removing people from the situation, right? This is not something you want to deal with de-escalation when lots of other people are around, right? There's so many family dynamics that come into play. And then that's when you want to use your de-escalation techniques, which we're going to talk about, and we're building that, but use some techniques that you learn in therapy. So really quickly, it could be some grounding, right? So feet on the floor, right? Where are you? Your feet are on the floor. You're in your bedroom. We're here together. We're safe. Use of the 5 senses. So what do you see? What do you hear? What can you touch? Where are you, right? In terms of reminding kids when they are in a safe place, to be able to kind of bring things down and not be in that danger zone. Counting to 10 and also breathing, it might be 10 deep breaths, whatever kind of works that the family's coming up with. And the ever so powerful physical contact, right? So a hug can be so powerful and so containing, or even just hand holding. So you might, given the situation, right, if families are asking for, I need a little help right now, think about these things and how families could adapt to this. I put timing in there because you want to think about like, what is the family asking you and what's being presented? I know I could think about when this idea did not work for me because I really wasn't thinking about what the client was asking me for, the timing. When I was a social work intern, the first family that I saw, teenager with some anxiety and depression. I met with her for the first time and had the family and one younger daughter and mom who had an infant. And I just started shooting off all these interventions and things that they could work on. They weren't asking me for that. They were just trying to get to know a new therapist and see, kind of feel things out. It didn't bode well for therapy. They didn't stay so long. So think about timing. What is the family asking for you? Is there a crisis? Okay. Collaborating with parents. Again, for those of you who were at the first webinar, which is great, you've talked about a lot of this. This is so key, right? How do you collaborate? So you want to provide your frame and the structure, right? What is therapy going to look like? Where are you coming from as a therapist? Tell them what this process is going to be like. Parents might say, am I coming here for a year, right? And you want to kind of set the groundwork of figuring out what do we want to work on, and you don't know how long that might take. But in terms of how things will work with individual and family sessions, be as clear as you can. Engage the parent or the caregiver as an active member of the process, right? It's huge. And I'll have scripts later on in terms of things that you might talk about with parents about their role and their importance. But we know parents and caregivers are the most important people in kids' lives. And for them to know that and hear that and to be treated as someone who's incredibly key in treatment. Again, remember curiosity, strengths, systems. Remember the referral context, right? So if someone is coming referred by Child Protective Services, that might feel different than coming from a pediatrician or coming from the emergency department. Thinking about how this family landed with you and how that's part of treatment and collaboration. So what I always think about, right? Therapy's hard. It's not easy. It takes a lot of courage to come for help, especially for a parent whose child is suffering, right? That's, I mean, I can speak as a parent. When your kid is suffering, that is not easy. And reaching out for help is not necessarily something that might come naturally, or thinking about different systems and if our agency is part of the system, and thoughts about that. Change is hard, right? Think about yourself for a minute. It is hard to make a change. If it were easy, people would just do it themselves, right? So this is hard work. Relationships with strangers are not easy, and thinking about trusting someone, I mentioned already about systems and lenses. And then we think about remote therapy and the challenges that go along with this. So I don't know about you all, but remote therapy has been really hard. I know all of a sudden we were like, go, right? Do this on a Zoom call. And that is a huge change. It can be harder to engage. It could be harder to collaborate. For some people, it works very, very well. But you think about how things are so different now and how can you collaborate? I mean, I had families that I didn't meet for a year plus. We finally met in person after a year plus of working together. And it's different. And naming it is oftentimes very helpful. Okay, so developing skills with parents and caregivers, right? And I know this came up in the chat while I was reviewing earlier. Why are we doing this, right? This goal for parents to develop skills around emotion regulation and distress tolerance, right? This is for parents to be able to develop these skills as well. So I think a pretty classic metaphor is this air mask, right? So anyone who's been on an airplane, the flight attendants, when they give their safety talk, right? If you need your air mask, if there's a drop in pressure, you're with a child, what do? You put your mask on first before you attend to your child. Parents being in the best, most regulated place they can be is what's going to help kids, right? want to be transparent about this. You don't want to just say to them, okay, you're going to learn this breathing technique out of the blue, because it would be like, why? That doesn't make any sense to me. When you're thinking about these skills with parents, if you think about with dialectical behavioral therapy in a group, the parents are learning these skills right along with the child, right? So as much as possible, and again, ideally, we know it's not always feasible, and I will give some examples of when this was really hard and didn't work so well, but we want parents to gain these skills to be able to use them both on their own and with their kids. Okay, why are you talking to me? My kid is the problem. So if you all were in person, or if we had everyone on the Zoom, I'd be saying, how many people have heard this before? And I feel like the majority of the hands would go up. I can't see people, so I don't know that. I'm looking in the chat to see if anyone's chatting. Why are you talking to me, right? Fix my kid's the issue. Yes, all the time. Thank you, Kathleen Felon and Jackie Brecher, and everyone else who's chiming in, right? I work at a children's mental health agency. The person who's coming in as the identified patient or client is the child. I've also been in, as I was saying, Ackerman Family Institute, right? That's family therapy. People are coming in specifically for families. I think probably many people are working in child's agencies where the child is the identified client. And so this is a real shift, right? It's a big shift, and recognizing that it's a shift is a big deal. So assume you're going to get a reaction, right? If someone were telling you, you need to, or I'm recommending that you do something, and you're like, what? That's not what I had in mind. That's not what someone told me was going to happen here. Of course, there's going to be a reaction. Labels like resistance are often used. I like to think about it as more like a reactance. In social work school, I did my thesis around reactance, and kind of when you're mandating or you're strongly recommending, there is a reaction, right? You want to give psychoeducation regarding family work. Consider the family as a client. So I've got a bunch of these scripts in here of things that I might say or things that I have said. And I hope people can use this, take it, make it your own. Everyone in a family affects everyone else. The way your child behaves with you is different than anyone else. The way you interact with your child is different than any adult. Often family members get stuck in the same patterns with outcomes that just don't feel good. There's yelling, there's crying, there could be giving in to child's demands, avoiding school, and anxiety. So the good news with this is that there's so many places to make a change, right? This could happen with a parent, it could happen with a teen, so many different ways to break this pattern that keeps on repeating itself, right? But the bottom line is that it's ending with people not feeling good. So great to work on it. Another piece in terms of talking to parents about stress, everyone is dealing with so much stress, right? You think about whoever you're speaking to in their particular situation. Is the parent working? Is there a remote school? Whatever the particular situation is happening. And your child knows you well, right? So kids know when parents are stressed out. Can't always be avoided. Stress can't always be avoided. But we're going to talk a lot about parents knowing their child's cues. Kids know that about parents, right? They know, they can read the room. So I'm asking you to be part of this process, learn skills that will help you connect with your child and help your child manage behaviors. Again, child, teen, interchangeable. Many of these tools and skills can be used by you, and for that matter, anyone, right? This is big. This is what, there's now social emotional curriculums in schools. That was not the case when I was a kid, I can certainly tell you, but thinking about these skills and tools for anyone and kind of for life. Okay, so we want to try to understand behaviors. So what is the parent or guardian's view of behaviors? Right, again, there's lots of different ways behaviors are understood. And then understanding why would a parent want behaviors to stop or to start. So when we think about these challenging behaviors and they're coming in because, I don't know, my kid's yelling at me every single time I say it's time to wake up for school, or I want them to clean their room, or they just close the door and leave it locked all day long and I can't get in. Why would a parent want the behavior to stop and start, right? Our understanding and thoughts might be different than where the parents are coming from. So one important thing is really trying to move away from good or bad behaviors and really reframe them, and to understand the function of the behaviors. So this example, a 9-year-old girl refused to get out of bed and go to online school. So this parent's disrespectful, oppositional, doesn't listen, won't get dressed when I tell her to. So in talking this through, the parent coming to understands that the refusal was really a function of anxiety. The child didn't understand the material on Zoom school, was really frustrated, and developed a huge amount of anxiety around the teacher calling on her in class. So what was initially seen as disrespectful, oppositional behavior could then really be looked at as this kid needed to protect themselves from the anxiety of being called on in school when the child didn't understand anything. So prioritizing behaviors to address, right? And we'll talk a little later in, around behavior modification. It's kind of like thinking about treatment planning. Families come in with a range of concerns. Many families are coming in with multiple psychosocial stressors. How to work on prioritizing goals when everything is urgent, right? Again, I could do a show of hands and I'm guessing that a lot of people would be saying, yes, 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 everything is the most important, right? And it feels like it is. So in this example, a teen with severe anxiety and depression, and the parent was very focused on the messiness of the room. And you know what? To that parent, the messiness was urgent, right? That was what they saw, and that felt urgent, right? So in thinking about these priorities, how can you kind of work through with parents? In the here and now, what is the most important thing for your child, right? So in this case, we could talk about she's really anxious and she can't sleep at night, right? We could get there in terms of kind of thinking about needs, kind of thinking about hierarchy of needs, and in terms of things like eating, sleeping, safety, right? And how those pieces are so critical. And then kind of thinking about like, what would happen if she just didn't clean up the clothing on her floor for like a week or two? Like, what would happen? It's kind of that reality testing type of idea, right? So if the kid didn't didn't go to school because she couldn't sleep, right? What are the consequences around that? And what are the consequences, excuse me, of not cleaning your room, right? So I don't think we have time for the how might you move forward, but it's something to think about. Okay. So I love this red, yellow, green idea because it's so concrete. This is relevant for anyone at any age. Thinking about this thermometer kind of metaphor. It could be around anger, it could be around emotions, could be about anything. It's very concrete. Everyone knows traffic lights, right? Can't get that wrong. And thinking about that for people's almost like their affective state, right? We want to be in the green zone. So that's calm, pleasurable, like having fun, good interactions, enjoying oneself. The yellow might be where there's some negative emotions, some bodily reactions to stress. So parents would be thinking about attending to the child's cues and working on ways to maintain some calmness and bring down the affect, right? So that's yellow, right? We're in yellow, room for intervention. We want to be in green and yellow, right? For ourselves, we want our kids to be in. That's going to be optimal for people. Whenever possible, trying to avoid that red zone or the danger zone, right? That's when people engage in ineffective behaviors, right? That could be unsafe. That could be part of a crisis. And we also know everyone inevitably ends up in the red zone. It cannot be avoided. If you think about yourself for a moment, have you ever been in a place where you're just so mad and you are yelling, right? People end up in the red. It's part of life, right? Finding ways to get yourself back, getting parents back, getting kids back into that yellow and green is the goal. Okay, so if we think about part two, ooh, I'm sorry. Oh no, I'm sorry. I thought I was sharing screen and I got a little pop-up. So excuse me for a minute. I forgot that it was Jim's screen. So if we think in this portion about relationship building, fostering self-regulation, and managing distress, that's what we'll cover next. This is like green, right? All the good stuff can happen in the green zone. So I put in some examples of things that families have done, or I've worked on with families or suggested to them about fostering the relationship, right? And one thing that we know is the relationship, that's the building block, and creating those building blocks around the relationship or within that will help when the yellow interventions are needed and the de-escalating, right? We want to have as much of that positive. You think from like a DBT standpoint, accumulating all those positive experiences, which will help you regulate affect and with your child. So one family that I will talk about later, the M family, they came in struggling very, very much. Severe family conflict, a lot of impulsive behavior by the child. This mom created the dance party on her bed where they would play music and dance and jump and have fun on her bed. And it was like family dance party night, right? Who would not want to be part of that, right? I know a dance party, jumping on a bed sounds really fun right about now. Would you rather? I don't know if you all are familiar with all these would you rather books and questions, but I first saw these well, let me give you an example first. I feel like it could sound a little risque unless I explain. Would you rather be a dog or a cat? Would you rather live in a castle or under a rainbow, right? Lots of different questions that maybe there's two choices for. I first saw this when my son was starting, when he was on remote learning in third grade. And this would be the warm up for everyone to have a chance to participate in the conversation as part of school. One thing that is so great about this is that you're given a choice so anyone can answer. So you think about smaller kids, younger kids, excuse me, ones that are, not having a hard time engaging. This is like this or that, and then everyone gets to participate. Oh my goodness, I'm sorry. I'm looking at the chat for a minute. Alex Bear, would you rather have suction cups for hands or wheels for feet? I love that, right? It could be you're thinking about these things a little bit and think about the family engagement around it. It's pretty amazing. I find that useful with anyone, number one, but for younger kids, I actually, in terms of a family where there are a range of ages of kids, all the way from 17 to I think about 4. In the session with the 10-year-olds, we used a set of questions. I think it might have been like teen talk themes or whatever it was, but more open-ended questions. And the family ended up buying this deck of cards and they would make that part of their family night, right? So the more open-ended questions might be about, those more comfortable in treatment if you're doing it in a session and, families who might have older kids, right? So all the things that can help in family relationships, and particularly in the time of COVID where options are limited. You think about this idea of special time directed by the teen or child. So really letting for parents to be able to let kids and teens take the lead, which I'll get back to. Teens, check expectations about teen participation, allow for teen choice. So if you, first of all, as a clinician, if you think every single teen is going to engage with you right off the bat, I think you're going to be kind of disappointed with that, right? Remember, teens are, they're figuring out who they are. They've got other things going on. Peers are so important, right? How much can you let them choose how much to participate and when, and be part of kind of actively planning activities or events with their input, and parents and their own reactions to that, right? Family fun time is going to look different with teens than with younger kids. And again, as I said, accumulating the positive experiences as building blocks for a relationship. So when we think about thinking about the relationship in kind of the day-to-day, the consistency, the routines, the rituals, the celebrations, right? So on a daily basis, how can you create that consistency in those routines, particularly in COVID when everything is just kind of upside down? How can you have these rituals? So graduations, birthdays, how can you make that a special time for the kid and the teen, particularly given when there's not a big graduation party or there's not an in-person graduation, right? As I was talking about special time before and thinking about this idea of joining in play at all ages. So why should I play with these dolls? This doesn't make any sense to me. I have no interest in this. Or why would I want to look at this video game? Work with the parents on figuring out how they can engage in a way that is really on their child's agenda, right? So if it's playing with dolls, if it's crafting, if it's watching your kid play a video game. I've watched lots of Minecraft and Roblox on my time. I've tried to play a little bit, not terribly successfully. So like my comfort levels, let me watch and let me understand, right? Okay, next slide, please. So in thinking about communicating with your child or teen, these are pretty universal. In thinking about teens, I think it's really important. So this idea of multiple perspectives and validation. So everyone has their perspective. You do not have to agree with your teen does not have to agree with you, but the importance of trying to validate, trying to put yourself in the shoes of the other, right? So for parents of, why on earth would I ever do this? Like, it is not okay for them to be out until 3 a.m. Yes, and the want to socialize with your friends, that is totally normal and understandable, right? So each person has a different perspective. For family members to be able to kind of hear each other, and just kind of let there be space for that, right? Be curious, notice accusatory language. Okay, so this was a conversation that I had with parents. Part of it was what they were starting with. So parents, you've been smoking all the time. I see your vaping stuff. I told you not to do that, right? That was potentially the approach. And with some working around how it might be received and heard, we came up with, I was curious as we spoke before about vaping. I saw the vape pen on your desk. What's been going on? Right? Allowing for space for teens to communicate with, for parents and teens to communicate without it being you know, I know what you're doing. There's no alternative explanation, right? There needs to be a conversation rather than an accusation if communication is going to be effective. Teaching I statements. So super basic and super key. How the other person's behavior impacts you. Focuses on the behavior, not the person. So I statement, I feel blank when you blank. Okay, so here's not an I statement. You make me so mad, right? People have heard that a lot. Or I feel really upset when you begin yelling at me about schoolwork. Think about what the other person is more likely to respond to. Recognition around privacy issues, respect as much as possible with teens, and developmentally appropriate for children. Again, thinking about teens and how much they're going to engage and at their comfort level, whenever you can, respecting and thinking for parents, respecting privacy. Okay. I see someone wrote about dialectics in that situation in particular. Jackie, thank you. Right? We think about kind of dialectics, this idea that there's not one right answer, more than one thing can be true, in kind of thinking about family therapy and this kind of a postmodern narrative approach. Everyone has their own perspective and being able to hear that. So thank you for that comment. So thinking about this idea of toolkits, right? And we'll talk about, because a toolkit could be like these physical things that you're using around staying calm, or it might be mantras, it might be thoughts and ideas. So what you want to do is create a calm space. You want to engage clients in relaxation. So that might be breathing, anything that helps in maintaining the calmness or getting from kind of here to here. And this could be with kids and parents, it could be with teens. So, little script here around setting up the frame and providing rationale. When we're upset and angry, we can't think clearly, and it becomes difficult or impossible to problem solve, right? Strategy. As part of therapy, we're going to work on these strategies to help you calm down during stressful times. The best time to plan this is when things are somewhat calm. Now is the best time to think about these tools. Right? The same way in therapy, you might want to engage, your clients around building insight when maybe not so much is going on, right? Because there's a space to think about things. The time to plan is when there's calmness to be able to use for the future. Okay, so creating it. Let's think of some things you can do to take a step back, relax, and be able to problem solve. Okay. So, sorry, if you can go ahead. These are examples of different tools. There'll be recreations, but this idea of building a toolkit when we think about distress tolerance, we might think about a crisis survival kit. Everyone needs an array of tools to manage stressors and strong emotions. Thinking about having or creating an emotional toolkit. I already said this. About strong emotions in the moment, right? So crisis survival, thinking about 5 senses for self-soothing. And this picture is one of nail polish and lip balm and hand cream, right? So we really want to think about 5 senses, right? What is soothing to people, right? What helps them to stay calm, something they enjoy? It might be the relaxation of giving yourself a manicure. Okay, so I have some examples. So these are recreations because I didn't take pictures with people or they were doing these in their own homes. So this is an adult who I was working with who had a lot of anxiety. So she had her normal life things that she needed to do. She needed to go to work. She needed to go to appointments. So we came up with her headphones. So she knew the music that helped calm her, right? And she was, when she was on the subway, she would listen, she kind of like hum it to herself. The cotton balls were really like sensory for her, right? So it really helped her. It just felt calming and she would just use those and she would touch the cotton balls and it was something that just helped her feel more calm. She also tended to kind of get fidgety and kind of move around all over the place when she was anxious. So one thing we came up with is that there's a lens and screen cleaning wipe, right? So she could clean her glasses. She can clean her phone when she wasn't quite sure what to do with her hands. Right? Okay, next toolkit. Okay, so, and this is a child. So I have some examples of adults, children, teens. She came in 7 years old with adjustment issues, some worries about COVID, sadness and anxiety, some school issues as well. So she was in a social skills group that I started during COVID. she developed skills there in terms of regulating. So I don't know if you can see this. It's like my mini lava lamp. I might have one here. I do. I don't know if I'd be on screen, but I'm gonna do a tiny demo, right? To me, this is one of a very, very calming tool, and just kind of looking at it and mindfully, what do you notice? I bought a bunch of these because I love them so much, and I gave them to all the clinicians in my office. So we would do that as part of group. As part of group also, kids were at home, so we could have them bring like what's something that you want to show the group or something that's important to you. So this is an example. I don't know if people know those flippy sequin types of things where they're like silver on one side and another color on the other side, but sequins that are kind of hard and rigid, that will look one way when you put them one way, another way when you go the opposite side. The other side of the pillow is a black velvety type of texture. So all these different textures, what you see, what you feel. She and her parent oftentimes did arts and crafts together. So in her box of things that she and her mother, so this is a kid who we really did a lot of this together. She made a beaded bracelet, and that was part of it. And she liked to like play with the beads as well. So a lot of sensory stuff, right? So this is a 7-year-old, lots of sensory. Okay, so a teen with trauma, anxiety, self-harm. So in treatment, she really focused on writing as one of the ways that she could get out her thoughts and feelings and really express herself. So in the box, a journal, pens, pencils, different colors. That little bottle is like a lavender scented oil, which is something she identified as something she liked to smell and felt pretty soothing and calming. And the eraser, both for writing, but also the rubbing of the eraser. And I say gently rubbing, right? This was not meant as a self-harm strategy, but to just kind of get a little input with the rubbery eraser. Okay. Mm-hmm. And this is with the teen. So when you think about with teens, like what does the teen want to share or is willing to share with the parent, so that the parent can be helpful to them and know the things that help them to feel better when they're not feeling so good. Okay. Okay. So here's a COVID tool belt. So an adult I worked with, she was home during COVID. She had a lot of medical appointments, and she really wanted to take her kids on a trip. So we really, as we were talking, this visual of, you know, like a cleaning person's like on a belt with all the pockets that you could stick in like the cleaning supplies. This became her tool belt, right? She had her Clorox wipes, hand sanitizer, gloves, and mask, her tissues. And this was her defense that she had with her at all times. So when we think about COVID, right, we can't control COVID, but this is what we can do. And again, parents talk to their kids about this. This is how we can keep ourselves as safe as possible, right? With this, with her giant box of Clorox wipes, she went to, I don't know, maybe Pennsylvania with her kids and stayed in a hotel, and everyone enjoyed themselves and were cautious, right? Okay. Okay, so I put in a couple of my favorite strategies. So people might be familiar with this already. So deep breathing. So we know the physiological effects of breathing on the body. It helps our system to calm down. Breathing is huge. You can do it in so many different ways. One way that I found is fun, is this buzz breathing or any other animal breathing. So I'll just talk it through like I'm talking to a family. And no one can hear or see any of you. So if you want to follow along and do it, it's really fun. Okay, so hi. Do you remember how I've been talking about breathing? When you take a deep breath and let it out slowly, it can help your whole body calm down. A fun way I like to do this is with animal sounds. Do you have a favorite animal? What does it sound like? So I've done this with lots of animals. Or if you want to do the buzz breathing, which is my favorite animal sound to do this is the buzz bees make. Can you buzz? Right? Buzz. Give everyone a chance to do their buzz. It may sound silly, but I always have fun doing this, and you may too. Take a deep breath in your nose and make your stomach like a balloon filling up. And you can't see my whole body, but I will really do that with my hands on my belly so you can see, right, showing people how this works. Then you're going to breathe out for a long time while making a buzz sound like this. And you demonstrate. So I'm going to do this, or I'm going to do it. So I'm taking my deep breath in and buzzing out. Okay, I could do that a lot longer, but for the interest of time, I'm going to stop. But how do you feel? Right. I know I actually feel kind of tired when I do that. Again, taking into what did they say? I feel really calm, tired. Can you think of a time when it could be helpful to do some buzz breathing together? Right. And that's the key. So you're teaching strategies, and when can families do this at home? Right. There are, again, lots of different sounds. One of my patients thought that I pulled in an audio clip because I think I did like a roar or howl, but it's like super fun. Okay. That was one of my favorites. And now we're going to move on to this yellow zone, right? So yellow zone, you're not super calm, right? Stuff is going on. So one piece for parents, know your child's triggers. Parents may have a sense of things that will end up with the child regime becoming dysregulated, right? You might know it's the first day of school, my kid's going to have a really hard time today, for example. The parent may be able to modify behaviors or limit, triggers, that should be, and limit or avoid triggering things, like maybe, right? I learned with my child that asking him as soon as I see him after school or after camp, asking him 10 questions about what he did that day does not lead to a nice reciprocal interaction. It leads to like, leave me alone. I feel totally overwhelmed. No, thank you. Right. So what I could do is not do that. Right. An example when you can't change things, right? Can you avoid school, or can you have your child avoid school? Like, no, but there are ways to make it a more calm, less experiencing, to make it a calm, less scary experience, excuse me. Right? So how can you manage when that trigger is just what it is, right? How can you make it easier, less scary, less feelings attached to it, okay? So then parents, know your own triggers, know how to manage, right? So we're first talking about kids. Now we talk about parents, right? What triggers parents? Could they inadvertently be doing things that contribute to the pattern of their child becoming dysregulated? Example, a parent anxiety, they're constantly asking around homework and the child becomes dysregulated. Let me come back to that. Okay, so they're a teen that I worked with. Mom had her own anxiety, and the teen was really struggling with a lot of issues and had a lot of sadness and depression and his own anxiety. When he would try to share with his mother, she would immediately, like, her eyes would well up as soon as he started talking, and she would cry, and it became very personal for her. And then he would just avoid the entire situation, right? Again, I think mom coming from a place of my child's suffering, this is so awful, I don't want him to suffer. However, her own emotional response ended up with him, not having the space for himself. So this was a situation where we couldn't really work on that parent gaining those tools. So we worked with the teen, right? Find different ways. Have space for your own thoughts and emotions. That maybe involves other people. So let me get back to the example before. An 11-year-old's anxiety, attentional issues, difficulty completing schoolwork. So mom's drive was to protect her child, right? She doesn't want him to fail. She wants to work with him and tutor him and do all the things that she can do so that he doesn't fail. But it ends up resulting in him feeling more anxious and disengaging, right? So her push, did you finish this? Did you finish this? Right? It wasn't helpful to him, and it just ended up raising his anxiety. So worked with this parent on psychoeducation. What was the impact of her pushing, right? How can she gain knowledge and understanding and insight into this, and finding ways to give up some control? So that's a big deal, right? A parent making a change that impacts the whole family system. I know this comes up at some point, but in thinking about why would this parent listen to the psychoeducation, right? You're talking about, talking about these patterns because you've collaborated with them. They're the expert on their family, they're the expert on their kids. So you're the one with the mental health knowledge, and you become a collaborator, not a teacher, scolder, judge. Right? Okay. So thinking about some sensory overload and downtime. So I can speak personally about this. I don't know how many of you are parents or have heard this type of situation from a parent. So think about the transition. Parents coming home after work, switching from work to parent mode. Maybe you're needing to cook dinner. Maybe you're needing to just put everything down and, thinking that you have to start getting your kids' stuff ready with homework and so many other things. Well, if you're coming maybe from like a nice bus ride or even the subway, you come home and there is noise, people might be in your space, lots of screens on, or at least like in my house, that can happen sometimes. So in thinking about parents, like when do parents need downtime? Right? When is that transition from home to parent like requires just a little bit of a pause, right? I know for me that happens. And it's not just for parents, but for everyone. You think about children and teens, when do you need to take a break, right? Kids going. When is a break needed, right? For their own choice of what helps them to kind of stay mellow, right? Our computers need to go into downtime every so often, right? And so do we. Mm-hmm. So getting back to kids, next slide, please. So kids, children's cues. Your child might show nonverbal signs of distress, right? They might indicate with words or behaviors where they're at. So you might see anger, hands clenching, voice volume increasing, moving around a lot, cursing, anxiety, fast-paced breathing, sadness, or withdrawal. What about hungry or tired? So hangry, if people heard hangry, it's actually now in the dictionary, this hungry, tired physical state. It is a real thing, right? Paying attention to those things. If your body is not fed and well rested, of course, you're going to be super irritable. You also want to know your child and trust your own instincts. Next slide, please. How much can they tolerate? Kids are different. How much stress around them, how much activity, what can they tolerate? When they are showing signs of distress, what can you do? So you want to for sure acknowledge they're in a tough spot. They're going to need to deal with issues they're facing, like going to school. You want to validate the valid, the emotions, not the behavior. So I know you're angry right now. When you're ready to speak with me respectfully, I will be around. And you want to practice the skills to help regulate, right? So when your kid's showing these signs, what are those skills that you developed? What did you do in therapy? What are those tools that you used? All right. Next slide, please. So in terms of thinking about families at home, it used to be that families were just coming to your office all the time, and they might be seeing the things in your office that might be the good reminder about things like emotional literacy. Well, we've been doing a lot of Zoom work and clients are also at home. So help them and they can build their own emotional literacy corner, right? Have the resources available. This is a very Easy to find online, my moods, my choices, for example. So I have clients where they have on their bulletin board or they have a little space. We'll get to the other visuals later, but emotional literacy around measuring, identifying, and managing emotions. Right. My next slide will be an example of an emotions thermometer. So it's hard to read my handwriting in here, but this was, people do anger thermometers. This was actually just an emotions thermometer, including coping. So if you can read this within the thermometer, right, what are those feelings? Going from calm and confident to that warning zone and the out of control zone. And this child was able to identify what he looked like. He was smirky and smiley and focused in the green zone, his hair. And he had like a squeaky voice is what he said. So thinking about in the client's words, and then he would be yelling or shut down, about to cry and anxious. So he and mom, we worked together on this. I made the thermometer, they made the thermometer around all the different coping. So I really like this as a really concrete way of looking at those different zones. 111. Okay, I'm going to try to be really quick. So more visuals you might have available, things like mantras, and having them available. It might be some DBT skills. A stop sign is very useful. Really quickly, just keep swimming. That was from a Finding Nemo reference for a 16-year-old who's having a lot of trouble in school, and his like, keep going, keep going. Last is do not stress what you cannot control is a mantra from a mom I worked with who really was able to, with doing all this hard work, come to a place of really focus on what you can control and what you can't. Okay. So another favorite, this is actually a link, so you can look at it yourself. It's on Spotify. It's amazing. This woman, Rhonda McGee, in mindfulness, she's got this stop practice, and really quickly, it's the STOP. The G is not part of that. I should have left a space. Stop, take a breath, observe, proceed mindfully and wisely. This loses its flair when I'm going quickly, so it's really useful. When there's more time, I would take a look. So let's get back to de-escalation. All right, so we talked briefly about some of the things to do. What is this red zone? Triggers can't be avoided. Behavior's unpredictable. People don't want to be out of control and feel unsafe. One consideration, which we'll talk about later, is this a crisis? Is this a tantrum, right? Is this behavior that's trying to get my attention and the kid can eventually calm down from it and doesn't need me to be part of this? Or is this kid really in crisis and parents want to help them? So some more points in addition to what we spoke before. You want to speak to your child in a calm, reassuring voice. Use the toolkit, right? Work with the teens on their toolkit. Encourage them to use it, see what you might be able to do with them. In just thinking about when do you need to use emergency assistance, use agency supports. If there will be times where parents do need to call 911, and really we know lots of issues around calling 911. I always recommend parents to make sure that they know they're saying it's mental health issues, right? Because that can determine who shows up at your house. Your clinicians, the agency should have after hour services. There's Mobile Crisis, New York Project Hope. I don't think we have time to share this, but this is a personal example very quickly of the hug kiss. This was something I developed with my sister and her son. Was the hiss, right? He was really very, very upset, and the hug kiss reassurance, and it became the hiss breathing. So the hug kiss and the hiss became this really amazing tool. I'm going to talk about, let me see, next slide, please. I'm going to just say quickly, in terms of validating and processing, you want to do all the talking and the conversation and the processing afterwards, right? When people are in crisis, they're not talking about any lessons learned. Do it later, right? Remind them that these hard feelings are not going to last forever. Okay. And finally, in the last minute before Q&A, behavior modification question mark, right? So super basic, positive reinforcement for desired behaviors and goals, ignoring or negative reinforcement for non-desired. behaviors. I put this in with a question mark because we talk about behavior charts and behavior plans, and sometimes parents are like, I did this, this doesn't work, right? So you may want to use some of these things, you may not. If you're working in this way, parents should be picking out very clear goals, examples, clean your room versus putting laundry in the laundry basket, right? Make it specific, make it realistic, get all A's versus passing all classes. Negative reinforcements around taking away screen time for like ever or 6 months versus like a week with a chance to earn it back, right? That's a consideration. And planned ignoring, right? So when it's a tantrum, when you know your kid does this and is trying to get a reaction and you end up giving into demands, think about planned ignoring, right? Can this kid safely write it out? You want to think about specific praise, like I really like how you cleaned up your room. Behavior chart I already mentioned. And again, this is a piece of pros and cons and how is it received by parents. So consider that. So in that very, very quick wrap up of behavior modification, I want to say thank you so much to my collaborator, Jim Rodriguez, and thank you so much to Fong with all of her technical assistance. This could not have happened without the two of you. And next is a Q&A.
Thank you.
I'll turn it back to Jim.
Thank you, Bonnie, and thank you for that wonderful presentation. And again, I really appreciate just the eclecticism in your work and bringing in a lot of different strategies, sort of informed by a lot of different frameworks. And I think that's what many clinicians do, right? That's what we do oftentimes when we're working. Just a few questions that have come up that I thought were really great. And if there's more coming in, we'll track them. But you know, what some folks talked about, and you and I talked about this, Bonnie, as we were setting this up, right? Oftentimes, in that last piece that you had about behavior modification is kind of tied into this, right? We often think about those, you know, common strategies, right? You know, sort of not giving kids attention to negative behavior and so on and so forth. So actually, one question that came in was really great. How do you help families reframe the idea of no fun if no desired behavior, right? So the if then, right? We oftentimes, actually, sometimes we teach this to parents, right? You know, when you're teaching kind of behavior mod 101, right? First, then, if you do this, then you get that. But one of the questions came in, how do you also move parents away from that when it's necessary or indicated, right? So some families, right, parents may have that attitude, right? You know, I don't give my kids attention if they do, unless they do X, Y, or Z. And some of the stuff that you're talking about addresses, you know, helping kids through distress and distinguishing, like what you were just saying, between a tantrum and distress that requires attention.
So I just want to make sure I understand that it's this idea of you get rewarded when you do positive behaviors and how to move away from that. Is that kind of the essence of it? Yeah, yep. So I think, yeah, we might want to think about particular rewards around particular behaviors and taking a step back for all the positives, right? And this, I think in the psychoed piece around this, in terms of those building blocks, all of the positives that come along that will in the long run help things later on. I did, Carolyn Webster Stratton does a wonderful group program, and there's one visual of the parenting pyramid, and it's all about the positive in the relationship building before you're getting to timeout and taking away things, right? But in terms of how can you give that unconditional positive, catching people being good, and all the positive before it turns into any negative. The fun times, the dance parties, the bubble blowing all together, that will help. I know it doesn't feel immediate, and you can say that, it doesn't feel immediate, but that will go into the building blocks of the relationship.
Great. Another question that came up, what would you say about kids sometimes modeling their parents' dysfunctional behaviors?
I would say, yeah, that happens. It's challenging, right? Kids see in a variety of different settings, different things, and people sometimes do what they see. I think it's an interesting question to have with parents around, like, what do you think this is all about? And different ways to kind of set the frame for more effective behaviors. And maybe like, what do you do to the parent when you're feeling particularly angry? And maybe that becomes the part of a conversation with the parent about their strategies.
Great. And you touched on this, and I think this came up as you were touching on communication, the work, the material that you had on I statements, of course, and communicating. But one of the questions came in: can you think of additional tools or resources that are available to help families learn how to communicate better and listen to each other?
I might need to give that a little thought and put that and put together some resources. I think, I don't know that this is really answering the question, but there are certain things around psychoed. Like I have these wonderful workbooks about ADHD and about depression and anxiety. And part of it in terms of parents having some information and knowledge about where their child is coming from, I think can be really helpful. I will also say the DBT material is huge in this. And I was reading someone's statement chat about the dialectics, right? So that kind of that being able to pause and think and reflect. The DBT skills things are really useful.
Great. Bonnie, this is a little bit related. This is a little bit related to the first question around, parents who kind of have this sort of, I only reward, sort of good behavior question.
Yeah.
But a couple of questions have come in. Tantruming, right? So, and I think you've kind of addressed this. A couple of questions have come in around tantruming and parents giving into the tantrums. And I think this is a really great question because I think oftentimes it gets into something you've touched on, but maybe you can clarify here. How do you help parents determine the difference between this is a child tantruming and you need to use planned ignoring, right? Mm-hmm. Versus this is a child in distress and you need to step in and help to use some of the distress tolerance strategies.
Yeah.
Thoughts about how you help parents distinguish between those two things and then respond accordingly?
I'm thinking in terms of, when you're having these conversations with parents, is this something that happens commonly? What is the usual kind of trigger to this? What's your usual response? What's the usual outcome, right? To kind of just even get some more information on what's happening. You want to think about what is the child's behavior? Is it unsafe behavior? Is it like when does it cross the line to unsafe versus maybe more annoying and frustrating behavior? When does it go back and forth from that? What is your usual response? What happens? Like, what would happen if you were to try just not doing that, right? And I think that's a key question that parents might not know. And they might try out and see, oh, well, eventually the kid does calm down after a while, right? But like in that piece of the function of the behavior, maybe the kid might be able to speak for themselves, but in thinking, what does my child want out of this? And what do they get out of this, right? It might be attention seeking, it might not, but sometimes it might be safely trying out what happens if I try planned ignoring.
Right. Trying to do something different and kind of treating it almost like as a sort of testing different responses.
Yeah.
Mm-hmm. Let me see. Yeah. Well, and again, there are a number of questions around tantruming. So, and I think we all know, right, as clinicians, that's oftentimes the most difficult sort of piece to work through. Maybe
I could just say, may I just add one more point in this? I think I was talking a little bit before in terms of parents' responses and again, children knowing their parents and what sort of response do they get from the parents. I have one parent who used to cry, become overwhelmed when her daughter was saying very, very cruel things to her. And it fosters this interaction, right? It fosters it, and the kids know, and they know that they're going to get a reaction from the parent. And when this parent turned to like, I'm going to do my own CBT in my head and my positive self statements, and I'm going to clean and I'm going to ignore, the kid's behavior kind of stopped, right? When she didn't see the reaction in the parent, she didn't see the huge upset, sad reaction from her, right? So in terms of parents and how do they manage, and how does their kind of these behaviors foster themselves? But again, kind of Jim, like you were saying, if you try something new, what then happens, right?
Right. And then actually, kind of piggybacking off of your example just now, where it's also sometimes coaching parents how to do planned ignoring. Another question came in, though, again, sort of in this theme. What do you do when that planned ignoring that you might be effective in getting them, though, leads to an escalation in behaviors? And the child just continues to tantrum and leads to sort of more verbal or even, physical, leading to more physical abuse. So going from verbal tantruming to just, physical tantruming.
Yeah, well, I think when things become unsafe, then intervention is needed. If you can think about, I'm gonna be here and I'm gonna hold you while you're not calm, right? And we're gonna sit here together, and it might be that firm hug, or you got the kid on your lap while you're helping yourself to stay calm, right? And I will stay with you. Again, young kids are smaller than adults, right? And it's not always the situation where I could kind of just take my kid and put him on my lap and hold him. But I think the physical, I think that is when intervention is needed, right? You can be, again, try to be really clear about the consequences, right? You need to put down that knife. You're gonna need to stop punching that wall. Sometimes I'm calling 911 could end up being more triggering than anything else. So in terms of kind of thinking about that, is that something you want to say, or is that something you eventually just get the agency to put on the phone and see if they might be able to help? But I think the physical, there's like stomping on the ground versus, holes or being self-destructive or destructive to other people. And that's when for sure intervention is needed.
And, I think that's where the green light, the green light, yellow light, red light sort of strategy, at least way of thinking about it, is what I'm hearing you say is in some ways, then you move into, sort of red light de-escalation and or some of the other strategies that you've talked about. Great. Well, I think that's all. I know we have just a couple of minutes left. This is Bonnie's information. If you'd like to reach out to her and send her any additional questions you have. And I want to thank Bonnie for an amazing webinar. Again, I also urge people to go back and see part 1 of this series, because I think the two of them really complement each other in many ways. The first one talking about many of the issues that you've talked about with regards to sort of developing a working relationship with parents before moving into the strategies. And then we hope that the strategies that Bonnie has described to you and talked about to you, that she brings from her many years of experience, are helpful, especially with de-escalating problems and thinking a little bit more about how to move and prevent those problems from de-escalation, from escalating, but then also addressing with the issues as escalation does increase. So again, thank you very much, Bonnie, for a wonderful presentation. I just wanted to mention we have an upcoming event helping students and parents this school year with what mental health practitioners need to know about special education. So for those of you who are working out there and work with kids, of course, in most instances, we do end up working with kids with special education needs. This would be a great webinar for you to sort of join us on. You can register at registration.nytac.org for that webinar if you're interested. And then again, for any of our offerings, you can go to www.ctacny.org to view past trainings. And also, please complete the feedback survey at the end of today's webinar. You could also contact the CTAC if you have any questions at ctac.info@nyu.edu. Again, thank you, Bonnie, for a wonderful presentation. Thank you all for attending and being a part of this webinar. And thank you all for the work that you're doing on the front lines every day.